Let's talk about testing. I confess I haven't really been paying attention to the status of testing, at-home testing, since the beginning when it was impossible to get a test and people were like, unless you knew or related to Andrew Cuomo. How has that come along? Where are we now in terms of testing and its availability? And what would you like to see?
Yeah, I think testing in the US has been one of the greatest failures of this pandemic. We've done it all wrong, what I would argue has been wrong. We focused on the wrong metrics around the test at the expense of focusing on the metrics that would actually curb transmission. And so all of 2020, we had a real focus on laboratory PCR testing for the most part. And even when tests were taking 7, 10, 12 days to return, we were still recommending, we, the scientific community, were still recommending that people got tests to limit transmission. But when you have a test that's taking 5, 7, 10 days, it is essentially absolutely pointless from a public health perspective. You need a test result that's going to be given very fast so that if you're infectious, you know your result before you go out and infect other people. And you need that test to be accessible. A test once a month or a test once you're feeling symptomatic isn't sufficient if your goal is to stop transmission. And so given that backdrop, something I've been calling for since really April or May of 2020 has been to increase accessibility in the United States to rapid tests that people can have in their home, so that the moment you start to feel symptoms or the moment your friend calls you and says, hey, I just turned up positive and we had dinner last night together, you might want to test yourself. There's no barrier to entry for somebody to get tested. We need inexpensive tests to just be at our disposal, similar to Band-Aids. We don't go out and buy Band-Aids when our child gets a cut. We have them in our cupboard already so that we can put them on and stop the bleeding when it's necessary. And it's the same thing with COVID tests. If we can put these fast, accessible, simple tests into people's homes, then we can really do a good job at stopping transmission. Even in the era of vaccines.
Do they exist?
Obviously,
I know you can go into the clinic for a rapid test.
Yeah, so they do exist now. It's been a very long slog to try to work on how to encourage the scientific bodies and the FDA and such to understand these tests, as I think of them as transmission indicating tests, or they're tests that turn positive when you're infectious. And they don't turn positive when you're not infectious, unlike a PCR test, which stays positive for way too long. And these tests do exist now, but as people have noticed, they're very hard to get. They go to Walmart or CVS and they find that they're sold out, over and over and over. But finally, the government is trying to increase accessibility and scalability of these tests, but it is taking time. And I've been probably the world's greatest advocate for trying to improve testing access in this country and globally. But there is a part of me that's starting to wonder, is this too little too late? I don't think so. But, I am frustrated that these tests were not in every individual's home, a year ago.
Yeah. Did we put any of that money, that we put towards finding vaccines and so on behind this?
Not really. The U.S. has generally historically been very, very poor at recognizing what are appropriate uses of money when it comes to public health. We have a very biomedical centric enterprise when it comes to how we allocate funds. And so if it's something you can inject into you, great, we'll dump all the funds into it. But if it's something that really is designed to stop transmission and work at a public health level, the public health strategies themselves are generally underfunded. And that's why, for example, when the vaccines finally did come about, it was like a shock to the system. Nobody knew how to really allocate them and actually distribute them in the States. It was kind of a surprise that we put all this money into developing the biology behind it, but then the logistics and the real public health part of it was sort of short-sighted and not really developed enough.
Like, why wasn't Fauci talking about this? Because this is an easy sell. I mean, even the most vaccine hesitant wouldn't be opposed to testing and making sure they don't have it. Even if they don't want a vaccine, especially with these new therapeutics coming out, they would 100% get a test and probably get a pill to stop hospitalization or death. So, I mean, why don't we put more energy into this? Do you think? I don't know.
It's been interesting. I've talked to both sides of Congress, Senate, the White House, both administrations. This is one of the most bipartisan efforts that could be in place. We've published on it an enormous number of times the last 18 months. It appeals to everyone because, like you say, everyone is happy to know if they're testing, especially this can be a test that is done in the privacy of your home.
Yeah.
So those folks in the country who don't want the government involved,
yeah,
you
exactly.
can use a test at your own counter and
I
nobody
know
has to
those
know
people.
the result.
That's right. And then
that's
you at
okay.
least don't go outside. I know a lot of people who are like, I don't want the government knowing I have it. So fine, you know, in the privacy of your own home. And then, of course, unless you're just a complete jerk, you would not go out in public and start breathing on a bunch of people.
Exactly.
So what about antigen tests and antibody tests? Do we have those at all readily available? And how could they play into getting all of this over with faster?
Sure. So the fast tests that I'm talking about now are the antigen tests. And an antigen test is a test that detects the protein, which is called an antigen in scientific terms, of the virus. And so the antigen tests are existing. Those are the ones like the Abbott test and the Quidel and the Illum that was just recalled. These are antigen tests. Antibody tests are different. And they are the tests that look at the person's immunological response to the infection or the vaccine. These tests also exist. There was a slew of these tests that were really poorly created and just not accurate back in early 2020. And these were fast antibody or immune tests. And that kind of put the FDA and the government, everyone kind of like pushed down antibody tests. Antibody testing and understanding immunology of pathogens is what I normally do in my research. And so it's been frustrating to see that even these antibody tests have been sort of downplayed, but now we're starting to see that they are becoming more available. There's one company that does it with just a swab of your gums. You take a swab of your gums and you can get a good antibody result. And I think we're underutilizing those because what we could do is we could say, hey, do kids really need 2 vaccines to be, or does any person really need 2 vaccines to be considered fully immunized if they've already been infected and have a strong antibody response? Maybe what we could do is we could take these fast antibody tests. And when somebody goes to get their first vaccine, they also take an antibody test. And if the antibody test is positive, then they get 1 vaccine because they've already been infected based on the antibody positivity. And then they are considered fully vaccinated without, or fully immune without having to get their second dose. That type of efficient public health thinking just has more or less been absent. And I don't know why. It's as though the scientific and policymaking bodies have decided or deemed that we can't trust immunity from infection. But when we have perhaps half of all Americans having been infected, we should at least leverage that. And we can't turn back time. I don't want people to go out and get infected so that they only have to get 1 dose of a vaccine. But the fact is, many people have been infected and we can't undo that. So we may as well utilize it to our benefit.
Well,
and I think that there's a real role there, but we haven't really brought it forward.
Kids in particular, because the negative effects of the COVID vaccine on like young teenage boys tend to come after the second shot, like the myocarditis and so on. So what if you could avoid that altogether? If you have to get a shot, you have to get vaccinated, perhaps you could at least avoid the second shot if you've had COVID and the antibodies show. But I'm sure a lot of my audience out there is saying, why do you need even 1 shot if you have the antibodies? You've got natural immunity. That is real. Study showed it's 27 times more effective at preventing infection, reinfection as the vaccines. And this is why a lot of people say we, like some countries in Europe, should be counting natural immunity already as an exemption to these vaccine mandates.
Yeah, I do think that we should at least be considering it. Am I going to get up here and say to you that I don't think we should give a single dose vaccine for people who are immune? Probably not. The reason I would say that is because we do know that the vaccine kind of supercharges the immunological memory for people who have been infected. Do I want to say that maybe we don't need both vaccine doses? Absolutely. I think there's good data to support that.